Thus far, we've been looking at organizational issues in child welfare from two distinct perspectives. One is from within the child welfare agency, that is funding, information systems, supervision, etc. And the second is by the framing of the issues. However, when you examine your wiki reports, you see two very different discourses. The former attempts to address child welfare issues from within the constraints of the organization, and the latter frames the situation in a scope much broader than any single agency could handle. Before we proceed to the obvious implications, however, there's one caveat. There may be some child abuse cases referred to the Children's Division in which there are no other complicating issues, such as mental health, substance abuse, domestic violence, etc. There may be some situations in which a family needs no assistance from other agencies in the community. Cultural competency is adequately addressed by all staff involved, and the court process is essentially unproblematic, with all the involved parties stipulating to all the allegations and agreeing to abide by all the court rulings. In these types of situations, the Children's Division is more than able to handle the case on its own and to handle it in an expedient manner. However, is this a rare or frequent event? I have a feeling that type of caveat may be rare. Therefore, the first question to discuss in your third report discussion forum this week is, what % of cases fit the criteria of having no complicating issues? Those of you who work for the Children's Division can respond directly to your caseload or caseloads you've had in the past. For those who do not work for the Children's Division, comment about the clients served by your agency or the clients you saw in your field placement as an undergrad. What percentage of those clients were referred by the Children's Division? And then for everyone, please comment on the percentages reported by everyone else. Did you think those percentages would be higher or lower? I would be especially interested if the Children's Division folks report a range of percentages. That is, it may be low in one part of the state, but higher in another part of the state. If so, speculate as to why. Since I'm thinking the percentage is going to be low, then we have some work to do. How do we address it? One conclusion is obvious. The Children's Division cannot do it alone. The implication of that conclusion is also obvious. Our communities cannot deal with the problem of child abuse and child welfare by placing that responsibility solely on the back of the Children's Division. Therefore, organizational issues in child welfare has to involve more than the Children's Division. Considering and working with other agencies in the community is mandatory. Remembering back to your community and organizations class, there are three broad types of interagency relationships: cooperation, coordination, and collaboration. The points you will discuss, or that you did discuss in your second report regarding what is controlled and not controlled by the Children's Division, paints a picture of a situation that needs to move far beyond cooperation. At a minimum, we need coordination, and ideally, we will have active collaboration. Therefore, I'd like to introduce the notion of a new entity that we need to ponder: a network. Some of you have already arrived at this idea by the conclusion of your second report, when suggestions for what would increase continuity between what is controlled and not controlled were discussed. What is a network? For our purposes, a network is an organizational structure that can consist of public, nonprofit, and other community groups working together to address the issue of child welfare. And remember that it involves both children and families in our communities. As a network, the participating entities may act on their own at times, but their combined activities result in a transformed whole that can achieve goals not obtainable by any one single agency. A network can engage in various activities ranging from communication, collaboration, sharing, participating in a task force, working together to deliver services. Indeed, anything the network thinks may help achieve its goal. Well, that sounds like a lot of work. 2, where's the money going to come from to do this kind of work? Good question, but ponder these points. A child abuse case, a domestic violence case where children are involved, a parent with mental health issues who ends up homeless, a parent who's chemically dependent who ends up in jail or the emergency room. All of these instances represent situations where our communities have failed. And they failed in ways that cost a lot of money for everyone else. The Children's Division cannot mend our communities. Only our communities can do that. As described in your second report, there are many professionals already involved in delivering mental health, substance abuse, and domestic violence services. Collaborating with them should be rather straightforward. Therefore, let's expand our horizon, knowing that the network is going to have to address issues that go far beyond what any of our combined professionals can do. As such, what can non-professionals do? Now remember back from lecture 7, we already talked about this related to domestic violence, and that it's something that probably was going on before the Children's Division opened their case, and it's something that may happen again after the Children's Division closes their case. So if we're to expand our horizons, knowing that the network is going to have to address issues that go far beyond what any of our combined professionals can do, what can non-professionals do in regards to mental health, substance abuse, and domestic violence services? That's the second question you will be addressing in this week's forum. However, when you do so, you need to think big. You need to think outside the box. You need to be creative. Consider everything that happens prior to the formal involvement of professional services. Think about everything that happens following the formal closure of professional services. Guess what happens way too many times after the formal case is closed? And the case is largely comprised of other issues like mental health, substance abuse, or domestic violence. That's right, the family recidivates. And how much of the current caseload demands are based upon recidivist cases? That takes a lot of time and money. The people that will facilitate a case not to recidivate are these non-professionals. Yes, working in a network will take time and money. However, not working in a network will also take time and money. And these non-professionals don't mean, or these non-human services professionals doesn't mean that they're not professionals. They could be an employer. They can be involved in social groups. They could work at school. They could be a healthcare professional. Or they could be friends, or they could be volunteers. But who are these people? We need to expand the range of stakeholders, and that also expands the way that we measure success in working with our families. It's just not the number of cases we close. It's how we actually look at client well-being, family well-being, and community well-being. So the third question to address in this week's forum lays the foundation for the third report, your next report. Your first report identified many strengths that as existing processes in the Children's Division bring to the table. In spite of these strengths, though, your second report identified aspects of issues not controlled by the Children's Division that impact children and families. Therefore, how might a network bridge these strengths to address these disconnects or things not controlled? So you want to make sure you answer the third question in light of how you answered the second question. So here are the questions or the issues that need to be discussed in this week's discussion forum. What percent of cases fit the criteria of having no complicating issues? What can non-professionals or non-human services professionals do in regards to mental health, substance abuse, or domestic violence? And how might a network bridge Children's Division's strengths to issues not controlled by the Children's Division? So please post your initial response by Thursday evening and then respond to the post of your peers over the rest of the week. And that concludes the lecture.